Good evening, good evening. Welcome to Braca Strong Live today with real talk, real change. Coming to you, Gaffney, our medical director. We're so honored to be able to host this live video and really talk about the real changes and have real conversations with women about the process of their journey as a survivor or as a previvor. So thank you everybody for joining. We're just waiting for Dr. Alexea to join. But in the meantime, I'm Tracy. For those of you that don't know me, thank you for tuning in. One thing that we really want to do on Braca Strong is keep it real and hear the real things that women go through and what we face. And it's important to share, your ups, your downs. Obviously, as we all go through this journey, it's not easy. We go through different situations, we face some complications, sometimes we have side effects from our medications, but talking about it and sharing and preparing other women for their journeys is just, I feel, so imperative in our community. Real is rare is something that I say often, and really talking about your journey and answering questions to women that have real questions. And we wanted to do this tonight to make sure that we open the door to previvors like myself and survivors like Dr. Alexea and be able to relate to women and give real answers. As again, we all face this journey just different ways. One thing is, again, making sure that you're real. And some women, obviously we try to keep it very simple. We're not here to scare anybody. We're here to give you advice and guide you, as I only wish during this time that I truly had the guidance that I have now from my community and friends. I feel like I don't know where I'd be without everybody else. Good
Hey
evening.
babe, how are you?
Girl, how are you?
Good.
What you driving?
No, I'm parked. Kennedy is getting her hair done, so I didn't want to be that obnoxious
Fancy.
person going live on the salon in the salon.
Listen, we gotta do what we gotta do, mom life, right? Like
That's
that's what we
right.
said.
That's
Like
right.
where we go, sometimes we just have to hop on lives. The other day I was sitting in a parking lot. I'm like, really, what is this?
Yeah, see,
But
you
now
know
I feel
that.
normal. Look. So, I was just telling everybody a little bit about tonight, what we're going to talk about, and how
Yeah.
important it is to be real, to be honest, and everybody faces things different. But
Hmm.
one thing that, really makes us one at Braca Strong is, our stories are similar, but they're different.
Yeah.
And what I said is, I'm a previvor, you're a survivor, and just coming together and making sure that we share information that women need or women are scared to ask their doctors. You guys can DM us, you can comment in the comments and ask
Yes. Please do.
any questions that you want.
Yes, please do ask questions. Let's definitely make this interactive. Let's make sure that people are getting what they need out of this conversation. We don't want to talk at you. We want to talk with you.
Right. And normally we both introduce ourselves. We're going to totally take this down a different avenue tonight and just really learn the differences, but yet the similarities in our journeys. Like I said in the beginning of the call, I didn't have resources like this in 2004. Like our community has changed so much, and
Yeah.
bringing everybody together is just, part of what we want to do here as a community. And to everybody. We're opening to everybody, to
Yeah.
anybody who's a metastatic, to thriver, to previvor, to survivor. We're here.
Yeah. Well,
So let's kick it off with you.
all right. Ready to
How's
get
that?
into it.
So, we always talk about our stories and come on, but, let's take it from the different perspective tonight. And I was thinking of, like maybe you could share when you were diagnosed, like how did it happen? Like what was your reaction? How did
Oh
you
boy. So, when I was diagnosed at 37. If anybody knows my story, then you know that my cancer diagnosis was 2 years in the making. It wasn't this like out of the blue, I got my first mammogram or I had found my first lump kind of a thing. And when I and probably this information was delivered this way because of who I am. I'm a doctor. But when I got my diagnosis by phone. And a lot of people are brought in and they know something is wrong because they're, being dragged into the office all of a sudden and told to bring somebody. But my diagnosis was delivered over the phone. And I remembered like anticipating my diagnosis, not being in denial about it, but being hopeful, like, well, maybe I just got a big ass tumor. And maybe that thing over there that I think is cancer isn't cancer, like kind of holding out hope. And so when they gave me the diagnosis, I was at work. There wasn't like this, breakdown and crying kind of a thing. Like I shed one little glory tear and then I was like, all right, wipe that tear away, get back to it. You got 17 patients to see. And my doctor offered me an appointment like an hour later from the phone call. And I was like, no, I'm not going to face this alone. I need my peoples with me. Of course, this is pre-pandemic when you could take your people with you. And so I called my two sisters. I called my best friend and they went with me. And then my other friend, who was my primary care doctor, met us at the appointment. She came home from a family vacation early to join me and my sisters at that. Well, me, my big sister, and my best friend at that appointment. And my sister was like, so how do you feel? And pre-cancer, like I was not an emotional, vulnerable person. So I was like, well, I don't know how I feel. I could be stage 4 and I would feel one way. I could be, stage 1 and I knew I wasn't stage 1 because the thing was staring at me across the room. Like I could be stage 1 and I could feel a completely different way. So I don't know how I feel. I'll know how I feel when I get more information. And it's just like, most people get the word cancer and they're like on the floor in a corner, writing their life off. And I was just like, I'll feel when I have more information, which is crazy,
Right.
but that's me.
But that's good. You let yourself wait until you got the information where like even pre-COVID there's Google, right? And even as a physician you probably, but that you stopped yourself until you had more information is so important, because
Yeah.
we get so overwhelmed by a diagnosis or finding out that you carry a mutation. Like, to stop yourself
Yeah.
might not have mentally, like as you said it just now, but really in reality it probably helped you and saved you a lot of the stress
Yeah.
that many of us face.
Yeah. I will say this, becoming more vulnerable, becoming more emotionally intelligent and in tune. It's so important to not let our emotions get the best of us and to not set the stage that this whole thing is going to be all doom and gloom and there's no room for a smile, for laughter, for a good time. Some people do that and they experience the cancer diagnosis and the treatment as this, wholly miserable thing. And that's not to say that aspects of it aren't miserable and that it's not uncomfortable or that there's no pain involved. But if you set yourself up that this is just going to be so horrible, so devastating, so painful, so bad, that's all it can be. You haven't left room for anything else to happen or to play out in that scenario, you know?
Definitely, I definitely agree.
Yeah. So
So
what was it like for you? Like, how did you end up pursuing your diagnosis of your mutation and entering into the world of previvorship?
So it's really interesting. I have a strong family history, and I literally remember seeing my breast surgeon after undergoing 2 lumpectomies at 18 and 19. And he's like, well, let's do genetic testing. You qualify. Again, this was in 2004. He was a breast surgeon, best doctor ever. Was like, let's see your risks. And if you're positive, you have 2 options, a hysterectomy or tamoxifen. And I'm like, okay, I'm not positive. I thought to myself, no biggie. He sent me to the hospital. I went in a room that was 4x4. I watched a video back when we had VHS. I watched the video and said, okay, fine, here, sign my consent. 6 weeks later, I got a phone call and they're like, you need to come in. And I'll never forget, I was dating somebody and I said to my mom, come with me for the results. I'm not going to be positive. Don't worry about it.
Mm.
Like, I'm looking over the desk, the medical side of me, and I'm like, oh no, I'm negative, but only thinking it said BRCA1 negative. And then she's like, well,
Hmm.
the good news is you're BRCA1 negative, but the bad news is you're BRCA2. And I was like, what does that
That
mean?
is a
Because
trash delivery.
I was like, what does that mean? First of all, you're a nurse practitioner. You're not a genetic counselor. You're not a geneticist. And technically, I'm not even sure you should legally be releasing these results.
Hmm.
But my surgeon got rushed into surgery, and I just left there with my mom. And I went online to NYU. I checked for clinical trials, and I just kept searching. And I said to myself, with this information, my youngest aunt died in her 40s.
Hmm.
Tracy, have kids, get married, have a hysterectomy and a prophylactic bilateral mastectomy. And from that day forward, at
Wow.
21 years old, I set my mind for that. Seeing my family go through breast cancer and how many family members we lost, to me, it was like, okay, I know I want kids. I don't want my kids to get it, see me suffer. What can I
Yeah.
do?
Yeah.
So I just jumped on the bandwagon, not realizing really what it all entailed. And still in 2021, I'm still learning.
Yeah. Yeah. Well, so much has evolved since 2004
For.
when you got diagnosed. I mean, they didn't even know that my mutation was clinically relevant back then.
Right.
I think it became clinically relevant in like 2015, 16. Something is burning down in Brooklyn. I don't know what's going on. I don't know if y'all hear all these
I hear
sirens
the
around me.
sirens. Welcome to New York. Love it. But I mean, technology has advanced, medications have advanced, clinical trials have advanced, I
Yeah.
mean, in every aspect, but there's still so much unknown to the genes like yourself, right? What year do you know when Pal beat 2? It's recent, right?
It's
It's not
recent.
that,
It's like 2015 or 16.
and
Um,
that's what's important, right? These genes are
yeah.
still being discovered
Yeah.
every day.
Yep.
As we're talking about genetic testing, maybe you want to talk about like, I know obviously for 2 years you were going through it, but like, what made you decide to get genetic testing? Were you your own advocate because you're a physician? Was it covered through your insurance? Like, what was your side of the genetic testing portion of being diagnosed?
So this is a hot mess. Okay. So I didn't get diagnosed with my mutation until after my cancer diagnosis. But in terms of trying to advocate for myself, I did actually ask for genetic testing because when I kept going for imaging, they kept finding stuff. I was getting biopsies, lumpectomies, surgical clips put in, um, and having to be screened every 3 months. It was not long before my primary care doctor was like, you need to just get them off. Like, get them off, get a new pair. Like, this is stupid. Like, that was her literal words. This is stupid. You
Right.
got ticking time bombs on your chest. Yes, Irina said, here comes the shit show of a story. Exactly. She's like, you got ticking time bombs on your chest. At some point, they're going to explode, And she told me before my first lumpectomy, which really was my second lumpectomy. I had my first lumpectomy at 21. It was a fibroadenoma. So unlike you, when I was 21 and I had a lumpectomy, and I said, oh my God, is this cancer? Does this mean I'm going to get cancer? I was told, nope, doesn't even increase your risk. We see it in young women. Don't worry about it. And I was fine for the next 15 years. I didn't have another lump until 35, and I found it on self-breast exam. But I was still 5 years from a screening mammogram, right? So if I wasn't looking, I would have been, just asked out. So, and I'm
Right.
sorry, I curse a lot.
No,
So,
real is rare. Talk about it.
So, so I asked for a prophylactic mastectomy. My breast surgeon said no, it's too radical. So I said, well, what about genetic testing? He said, you're not a candidate. I was under the care of a breast oncologist as well. And, I brought it to her as well. Like, can't I just get a prophylactic mastectomy? This is crazy. Like, why are we waiting? She's like, we're keeping a close eye on you. Don't worry about it. They gave me this impression that I had time, right? And, we know numbers, right? We know statistics, and the statistics are not in favor of what's happening with young women, right? Statistics say the average age is like 55 that a woman gets diagnosed with breast cancer, but it doesn't say that women are getting diagnosed at 18, 21, 30, 36, 37. So, they told me, no, it was too radical to cut off my breast, and my family history did not support me getting genetic testing, which I've heard from 100 genetics counselors that was completely untrue.
Mhm.
And the reality is that instead of saying no, they should have just referred me to the experts in that arena, which would have been a genetics counselor.
Which are
Not
often
to,
not referred to, right? Like we're not
right,
referred to.
right. And I'm like, as a physician, I'm always like, let me stay in my lane. I'm staying in my lane. I don't want to do things that I'm not the expert in. And they're not the experts in genetic testing. They don't sit in their office and write out your family tree and do all that stuff. They throw the family history in a box. And if they look at it, great. If they don't,
So be
who
it.
knows?
Mhm.
So it wasn't until I was 37 with cancer in both of my breasts. And when I went to see my oncologist, a week after my cancer diagnosis and my mastectomy with my surgical drains in place, it was like, well, you're too young to have breast cancer and you have cancer in both your breasts. That's not typical. You need genetic testing. And that's how I got genetic testing. So that's crazy. And I'm going to just share one more thing before we bounce it back to you. So, my dad taught me you can learn something from anybody, like a drunk, a crackhead, whoever. Like, don't ever dismiss that somebody may know something more than you, right? So the Myriad rep that used to pop into my office, I had known her as a drug rep from antibiotics, from when she used to wear an infectious disease hat. And this was a woman who did things that were like highly inappropriate, in the drug rep world, just unprofessional, right? So when she came into my office with her Myriad MyRisk, blah blah blah, and she was like, you can pretty much test everybody. Like, I'm gonna leave you two kits, and just think about it or whatever. And something happened where I had sort of run my story by her on another time that we met, and she was like, you should absolutely be tested. And I think it was before I questioned my breast surgeon and my breast oncologist about this. And so when they were like, no, you're not a candidate, I was like, okay, she's still crazy. She's trying to get me to just use this kit so she could say, I went to Dr. Gaffney's office and
Does she
they're
order
using the
one?
kit in her office, right? Just totally disregarded her because of a past experience I had with her. And then when it turns out I have this gene mutation, and have this cancer diagnosis, when I decided that I had to leave work, I could no longer work. I was packing out my desk and I opened up the cabinet because like I normally have like snacks and stuff in there to clean out the cabinet above my desk. And there was those two kits that rep had given me. And I felt so foolish because here's a messenger, right? Here's someone who's telling me to do something that served my interests. Although I would not have wanted to do a full Myriad panel. I wouldn't want to know everything in that test. But if I had had that conversation with her when my doctor said, no, you can't have this test, I could have explored the cost of testing. I would have understood that it wasn't going to like break the bank to get this testing and pay for it out of pocket. And so, don't shoot the messenger and don't shoot down what the messenger has to say.
Right.
Um, you can get so much valuable information from anybody. And that was just like, it crushed me when I went back to my office, post surgery in the throes of chemo. Cancer and chemo is like kicking me out of work, wreaking havoc in every area of my life. And here's these two kits that this woman presented to me and said, no, I think you should do this test.
But the difference is, right, like when we say we have all these resources and stuff, but like think about the benefits versus the risks. You went through the right process and got the right answers. Like, and different pharma companies that do genetic testing offer different services. You know what I mean? But
Mm-hmm.
obviously, like I know Invitae offers services. It's $250, and your family's free if you're positive. I mean, you can't beat that. I paid
Exactly.
$3,000 for my genetic testing, and you get a call from a geneticist to talk to you over the phone, color too. Like, these resources were not available.
Right.
You know, before we move forward, though, one lady posted about pancreatic screenings for
Mhm.
BRCA2. So I'd like to touch base on that, and then you can touch base on it if you want to.
Yeah.
So right now, there's really no screenings for pancreatic cancer, right? Is what they're saying. But there is clinical trials all over, and a lot of them right now are being offered, obviously via Zoom or via telehealth. They're at no cost, ladies. Google BRCA screenings for pancreatic cancer in clinical trials. If you have questions or answers, please let me know. I will help you. I know Dr. Sarah Joseph in Baptist, I believe, is having a clinical trial for BRCA and pancreatic screenings. Just because there's not a screening, there can be other ways that they're working on that nobody knows, right? Like, that's the great thing about clinical trials. So just stay tuned. From my perspective, I could say as a non-medical physician, and also, if you don't belong to My Gene Council, for $35 for the year, you upload your entire genetic screenings and they send you updates on your specific gene. Like, so for Dr. Alexea, the Pal B2 wasn't out there on the market yet, right? Nobody knew, but it was developed, and you sent them your results before, they would notify you.
Yep.
So basically in your sequencing. So just stay on top of genetic testing. If you're positive, there's always changes and new things coming to the market. Pancreatic screening is probably like, I don't know how far it is, but I know it's scary for all of
I'll
us
touch
that
on it. Yeah.
carry the gene.
Yeah.
Go ahead.
So, with the PALB2 mutation, which is very clinically similar to BRCA2, except the risk of ovarian cancer is not as high. I'm at risk for pancreatic cancer as well. And so I am in a pancreatic screening protocol. They don't call it investigational, but you can't just go to a run of the mill gastroenterologist and ask them to do this for you. You need to be at a cancer center or a university hospital setting in
Yep.
order to get this. So what the pancreatic cancer screening consists of is alternating MRIs of the pancreas and endoscopic ultrasound. So when they do the endoscopic ultrasound, they're going down your mouth, your esophagus, or your swallowing tube into the stomach, and they use an ultrasound on the end of the scope to ultrasound the pancreas and look at the ducts, look for mass in the body of the pancreas, look for any obstruction or enlargement of the ducts that would suggest that there's a mass in there obstructing the ducts as a potential for pancreatic cancer. And, having this screening is as scary as it is relieving, right? It's a wonderful thing to know that, okay, the cancer that I'm genetically predisposed to is not in there. But then there's always the thing, well, what if they find something? Well, if they find something, they can potentially act on it, right? So if a mass is in like the tail of the pancreas or the tip of the pancreas, they can take it out and do some additional surgery in the surrounding tissues, usually like the small intestines. But if it's in the head of the pancreas, they may have to take the whole thing out and do what's called a Whipple. So they take out like your pancreas, your gallbladder, and I think a portion of the small intestines in that procedure. And that leaves you basically an insulin dependent diabetic. So, Desiree, definitely, inquire about where you can get screening, if you can, find investigational screening, if it's not available where you were treated. But don't just be like a sitting duck, like just sitting on this organ, especially with a family history, because the risk of pancreatic cancer is more tied to family history when you have a genetic mutation than necessarily the mutation itself, right? You may not express that particular cancer even though you have the gene if it doesn't run in your family. And then other things you could do lifestyle wise, weight management. So obesity, history of diabetes, very high carb diet, high fat diet, things that like basically are taxing on your pancreas, increase the risk of pancreatic cancer, even in people who don't have a genetic risk.
Wow. So there's a question. Let's see. I'm BRCA1 positive and trying to get my parents tested in Brazil, but their doctors won't do it. So I don't know. I don't know if you can answer that. I don't know if color or Invitae's in Brazil that are like the saliva kits. I believe for some reason Invitae is. I don't know if you can answer that.
I know that a couple of the kits, like you can do some of the commercially available testing. Um, and the max out of pocket is, depending on the kit, maybe like 150, $169. The max I've ever heard is 250.
Yeah.
And so if you can go through one of the commercial labs, I would just go that route. And now with COVID has opened up, telehealth services, including telehealth genetic counseling. So I would pursue that, because if it's cash out of pocket and you're going to be paying cash for the test is going to be much cheaper if they know they're not billing an insurance company. But it's important to know.
Joan, screening is not available for you. If you have any questions and there's any guidance that we can give you, screening should be available to anybody. You can either go through your insurance or you could pay out of pocket. There's also foundations that pay for you to get genetic testing based on your ethnicity and your backgrounds. There's all kinds of resources out there. And, that's one of the things that we want to actually help women do also is know there's resources. There's different centers. There's different universities, because you don't have insurance. No. Let's make that difference and everybody step up and, be responsible, get your screenings and just stay on top of it. And no, it's not anything we all want to hear talking about Previvors or survivors, but it's real talk.
Mm-hmm.
And talking about the real facts of life is so important. Commercial testing is expensive and you literally agree to allow them to keep the results. So Joan, on that comment, there's definitely different labs that have kept our results hidden. Again, I was in 2004, so I'm well aware of, what I've lost and who's patent and stuff. And you just have to be careful with those companies, maybe looking into color, which is there's $150. And if you go on BRCA Strong, there's a $50 off coupon. There's Invitae, and they call you with their results over the phone with a genetic counselor and continue to walk you through each step of your journey, which wasn't available, I guess, to me, when I was diagnosed. So ladies, if you haven't seen a genetic counselor and you carry a genetic mutation, follow through with that genetic counselor. The same thing as a survivor, follow through with, your social workers and the resources that are available out there. Because a lot of us kind of go into an isolation and don't realize half the things that are out there that are available. I mean, you could probably relate to that.
Yeah, definitely. In terms of, a company like keeping your results, I understand that concern and what are they doing with my information and all of that. But the flip side of that is that as they, learn about new mutations, or they find out that something that was, of undetermined clinical significance, like PALB2, right? Years later, they may say like, hey, you have a mutation that is now, linked with X, Y, and Z. And they're supposed to update you with that information if things are evolving and they still have your sample and they can retest or test against newer genetic information. So there's pros and cons to everything, and we have to be careful that we're not cutting off our tongues to spite our faces. If you can definitely, go with a lab that you feel like you trust more of what they're up to, great. But, also consider the flip side of it.
So Joan posted, let's see. If a person does test positive for these genes, how can they prevent the problems? So first, go ahead. You want to talk on it?
So you can't always prevent unless you're talking about becoming a previvor, right? So if there is a risk for breast cancer, right, you can have a prophylactic mastectomy. That's really the only true way to prevent breast cancer. You can have a prophylactic oophorectomy where you remove the ovaries and the fallopian tubes. Some women, don't want to go through menopause, and they may opt to just remove the fallopian tubes and not the ovaries, because a lot of ovarian cancer originates in the tubes, not necessarily the ovary itself. And then you can, kind of do some risk reduction in terms of lifestyle, right? So, weight always comes up, and I don't talk about weight from like a not body positive perspective, but the reality is that there are increased risk of most cancers associated with being overweight or obese, and a lot of it has to do with increased inflammation in the body as well as excess hormone production. So for those of us at risk for breast and ovarian cancer, our belly fat, that extra fat that we carry in the body, produces estrogen. And so if you have a hormone responsive cancer, you can totally understand why carrying excess body fat is an issue. Diet and lifestyle is important, but understand there is no perfect diet. There is no absolute cancer preventative diet, right? I encourage people to eat whole foods, eat more plant-based. But, being a vegan is not going to totally prevent cancer, especially if you're genetically predisposed. And then, other lifestyle things that we take for granted: getting enough sleep, hydrating, exercising, moving your body, minimizing the amount of alcohol you consume. These are all things that can help, but there's not one perfect solution. So do the best you can when you can, and, try not to, sweat things too much. You go get your screening that's age appropriate, or that's appropriate based on your family history, your genetic risk, and age and other factors. But don't let cancer take over your whole life.
There's a couple questions on genetic testing with it. I'd kind of like to do, ladies, send us a message. We'll go back and answer your questions on genetic testing. SBC, I see that you asked us a question and you're trying to find ways to stay positive. I definitely could relate, Dr. Alexea. Maybe you can relate. She said she's had 5 surgeries over the last year. Maybe you want to just touch base with her, talk to her for a second and, advise her a little bit from your perspective as a survivor and facing what she's faced. And then we could shift focus back a little bit to why we're here, what we're sharing, and why it's so important that we're on talking tonight. I feel like, a lot of us get more answers when we're having conversations like this.
Yeah. So SBC, in terms of quote unquote staying positive, it's not realistic to be positive all the time. It's a work, it's a mindset, but you also have to allow yourself to have all of the negative feelings that come along with having a cancer diagnosis. To be angry, mad, pissed off, with the universe, to have the questions of why, to be sad, overwhelmed, all of those things are very real feelings. They are valid and appropriate feelings. And I think it's important to allow yourself to have and experience those feelings, because whenever we try to suppress negative feelings, we're inadvertently suppressing the positive ones too, right? So being in a state where you're being positive to the point that it's toxic, and you're not allowing yourself to cry, not allowing yourself to be sad or mad, you're putting on this happy face, you're wearing this mask. In reality, dampening those feelings tells your brain oh, we don't emote, we don't do that over here. And so when there's an opportunity for laughter, when there's an opportunity to celebrate, to be joyful, to I'm gonna even say enjoy or feel music, because this is one of those things that occurred to me looking back on how I used to mask and suppress negative emotions. I was shutting down the positive ones. So I think that's part of it. And then being in the practice of gratitude, finding something that is working and going right. I did that throughout my cancer journey. Every single day I found I wrote 3 things that I was grateful for. And in the beginning, it was just like, I'm grateful I have health insurance. I'm grateful I didn't sign my divorce papers yet. I can keep my ex's secondary insurance. And like, it was all kinds of crazy things that I ended up being grateful for. And when bad things happened, I would also look for that silver lining, or for me, I would make the lemonade, right? So I had to stop working. But the lemonade was I got to spend so much more time with my daughter than I ever had in her life. And I got to go through to so many school events that I never got to attend because I had to stop working because of complications with my cancer diagnosis. And I think, that's the flip side of the coin. That's the positivity. That's not toxic. That's not fake. That does, that it doesn't allow room for sadness. Like, I think avoid that at all costs. I just think, when sadness comes, allow yourself those feelings, deal with them, but don't unpack and live there. And if you need to get therapy, mental health counseling, whatever it is beyond just, writing in a journal, then by all means, go ahead and do that, you know,
Let yourself feel the feels, like you told me, right?
feel all the feels.
Feel it all. That's it. And, like you said, just to push through that is so imperative. And make sure that you find some light at the end of the tunnel, especially like going with your daughter and taking that and making it positive is such an inspiration, because so many of us lose that opportunity where we're working or we can't be there, or we're not strong enough, just finding other outlets that make it positive, no matter how to roll over in the morning, right? To be with Kennedy.
Yep.
So, how old was your daughter when you were diagnosed?
Kennedy was 6 when I got diagnosed.
Go ahead.
And that was like, you know, she was at an age of understanding. She is a very precocious child. She's a very observant child. And, there was not going to be any hiding this from her, because it was going to completely change her life. Like, our lives, and being a single mom, we were side by side, except for when I was in the office and when she was at school. And so many things about our lives were about to get disrupted that I was like, okay, I got to let this baby in on what is about to happen to my, you know?
Right. And being honest and just like, even, and maybe a lot of girls, need to hear this, like as you lost your hair and
Mm-hmm.
Kennedy supported you, like, what was that like maybe for Kennedy, and how over the years she's evolved to watch you, feeling better, feeling stronger, being active, trying, taking her to get her hair done, going
Yeah.
shopping, going hiking, like, how is that, do you think, like, helped your life? Like, how has it changed your life? How does Kennedy, like, we talk about all of us, right? But like
Mm-hmm.
our kids these days, it's real changes. It's
Yeah.
real time, like our kids, and I can definitely talk about like Gabby's, but talk about Kennedy a little bit, like how she reacted, and was she your supporter? Like, did she
Yeah.
like you said, she understand she was precocious, and our girls today obviously are a lot more precocious than when we were younger,
Yeah.
right?
Right.
Like, I mean, they're a lot more advanced.
Yep. So, she was on spring break when I got my diagnosis. So she was away in Virginia with my dad. And I flew down to Virginia to, tell my dad face to face about my diagnosis. I wasn't going to tell him that over the phone. Especially not, he's with his, 5 or 6 grandkids he had with him at the time on spring break. And so I wasn't going to just tell him that and leave him with the kids. I didn't want to tell Kennedy over the phone. And I wanted to give her time to process that. Like, I didn't want her to come home Sunday night from vacation, their school Monday. And I'm like, oh, by the way, I got cancer. It's about to change. So, I didn't know how or when I was going to tell her. And I actually told her before I even told my dad. But I was at the playground on the timeshare property with the kids, and I was sitting in one of those like Adirondack chairs,
Hmm.
and Kennedy hopped off a swing. and she just came and she sat in my lap, like facing me, like kind of straddling me. And I was like, well, I guess I'm gonna tell her now. So she knew I had the biopsy, and she's had the experience of me having surgeries and biopsies before. So, I let her know that I had the biopsy and the results were not good. It meant that I had, cancer. And of course, she was like, well, what is cancer? So the way I explained it to her is that I had bad cells that were growing out of control. And if we did not take the bad cells out of my body, then they could go to other places in my body and damage my organs, and it could really be bad. So I explained to her about my surgery, that I was choosing to have both of my breasts removed, and I let her know, like, I'm telling you all of this because it's gonna affect the way mommy takes care of you. I won't be able to lift you in and out of the bathtub. I won't be able to do piggyback rides, and then I have to have, this medicine called chemotherapy. And even though the medicine is gonna heal me or cure me, really cure me, we heal ourselves. Medicine's cure, we heal ourselves. Even though the medicine is going to cure me, it's going to cause me to be sick. It's going to cause me to lose my hair, affect my nails, my skin, all of that stuff. And so, I was just telling her, like, I want to prepare you for this, etc. And she was kind of laying on my chest for most of the conversation. And, when I was like done, and I was like, do you get it? Do you understand what I'm talking about? And she sat up and she had tears in her eyes, and she looked me dead in the eye and she said, Mommy, are you going to die? And I was like, well, she got the message,
Right.
She clearly processed this. Clearly, I gave it to her at a level of understanding that she understood, like, this is a big deal and
Right.
it could be life threatening. And I told her, no, I'm not going to die. But this, it does kill people, but I have to go through this so that I don't die. So fast forward, going through chemo and hair loss. I remember getting like dressed for our family's annual barbecue, and trying to decide whether or not I was gonna wear a wig or a head wrap or whatever. And I had initially put on a head wrap, and Kennedy was like, can you please just wear the wig? Please wear the wig, don't wear the head wrap. And I wasn't gonna wear, like, just go bald, because our family barbecue is my sister and my stepdad's birthday. And I didn't want my illness to take away from their celebration. And so I didn't want to go there looking sick. And Kennedy didn't want me to go there looking sick. Like, she was like, please don't wear that head wrap. It's embarrassing. And I remember my boyfriend at the time, like, when we had a conversation about it, because it hurt my feelings, that she would possibly be embarrassed. And he was like, that's just rude. Like, that's unacceptable. She shouldn't speak to you that way. And I'm like, well, my God, like, she's 6 and her mother's going bald. Like, I'm glad she told me she feels embarrassed. And I ended up wearing the wig for Kennedy's sake, because you know what? I don't want my baby to be embarrassed. And she was 6, not 16, right? But as the summer went on and the head wraps and the wigs got too hot and I had scalp tenderness and all that stuff, like, she just rolled with my baldness. Like, the funniest thing is, we were at a birthday party one time, and it was a pool party. And so one of the little boys, just observed, like, he's like, hey, miss, like, why'd you shave your hair? And she immediately jumped in. She was like, no, no, no. She didn't shave her hair. She has cancer, and her medicine takes away her hair. And she was like, it takes away all her hair. And like,
That's
all the moms
hysterical.
knew exactly, what she was referring to and what she was talking about. And it's just one of those moments that, I look back on and I laugh about, like, how much she got it. When I had chemo brain, she became my little voice. When I, like, couldn't get words out, she'd be like, what mommy means to say is X, Y, and Z, because we'd spent so much time together that she could communicate or know what I was going to say. And she became my little cheerleader. So there would be days where I didn't leave my bed, and other than to go to the bathroom. My family was bringing food upstairs to me, or she would bring food upstairs to me. And sometimes she'd be like, you know what, Mom? You haven't left your bed all day. You haven't left your room all day. Just come down the hall and sit in my room. And she would like prop up the pillows and pull back the blankets on her bed. And she'd be like, you just sit here and watch HGTV. And she would give me the remote. So like, I'll just be over here playing. I'll play by myself, but at least you left your room. And one thing we used to do was like go watch sunsets at the beach. And she would say, Mommy, like, just come on, get up, just throw on some leggings. I bet if you hurry, we could catch the sunset. And sometimes that would be the only reason we left the house
There are motivators.
because she was like pushing for that. So we definitely are each other's cheerleaders and encouragers, and she has definitely pushed me, and some days it felt like carrying me through this thing.
Right. Which is the best thing, that there are cheerleaders and on our side to help us, get through our journeys.
Yep. So how about your baby girl? How's it going with you guys in the world of previvorship?
So Gabby is my reason.
Gotta have why.
She's my why. When I had just had my prophylactic bilateral mastectomy and was going through an infection, and I had to have one removed. My expander was infected. It had to come removed. And obviously one breast was a little bit filled with like 10 cc, like 30 cc's. It was so small, but obviously, you could see the difference. And she looked at me and she's like, you're like a butterfly. You'll go through the stages and be beautiful again. And I was like,
oh my God,
I can't even like fathom that she's 7 years old. And she's like, no, you're like a butterfly. And we're going to get through this. And those words still stick with me, still bring tears to my eyes every day. She fundraises, she supports us, she wakes up, going through what I'm going through right now. She is my biggest supporter. Like you said, Kennedy said, well, wear a wig. Gabby says, don't wear a knitted knocker. You don't need one. Be yourself. Get out of the house. Stop wearing sweatpants. And I really am thankful for her and her strength to want to do this, to want to do giveaways, to want to get on to educate. And she then started creating some of our canvas and just being involved. And I think having our kids involved and knowing what it's up against, and I was always honest with her, from the time that I can remember, I said, this is what's happening. And she understood, no more babies, she understood that whole aspect after I had my son, and the mastectomy part was definitely harder, to explain to her, but she understood when she saw other women going through breast cancer. And she's like, I want to do the same thing. She still tells me, she just turned 12. If I'm BRCA positive, I'm going to do just what you did, and my life's going to be normal. And it's an inspiration for me, and I hope that everything that we teach her, she really understands. And she comes back at me she says the other day in the shower, Mommy, I understand breast cancer, but can I just get it without the gene? What do I do? And I'm like, yes. And I, walk through the process, Gabby, anybody can get it. It's not just based on your genes. And she was like, what do I need to do? We talk about self-breast exam, and she's like, do I need to start? And I'm like, you're 12. You don't have to start. We'll start at 21. Our youngest aunt died at 40, but she's been through it all. She's seen it all. I think now the fears are maybe some PTSD for her, fears, and I'm sure Kennedy too probably is
definitely has a little.
What's going to happen now? With going through what I'm going through. She's like, what do you mean you're going to have surgery for 8 hours? What do you mean? I processing it for her is a little different now, I think, but knowing that I'll be able to go out there and pitch softball and play games with her, and never thought that this part of my journey would take me a little bit away from my motherhood and going through a hysterectomy at 32, not being on hormones, and, just facing the facts of life of going through menopause and hot flashes and, walking around with peppermint oil. They're like, you smell good. I'm like, great. Because before it was like, you stink. And I'm like, stop telling me that. But they understood, and my son is like, don't do it, it's too much. But now he puts it in his bath. I'm like, you see, it's soothing.
Mhm.
So just being honest and open with them and communicating like the real facts. Like, no, I don't want to really have to tell you that you have a 50% chance of this genetic mutation, but these are the facts of life and
Right.
it's going to be changing. Like, and I look at her and I tell her, 2004, we didn't have none of this.
Right.
I didn't have support systems like this. There
Right.
was nothing. Like, so no, maybe in 5 years there'll be a vaccine or there'll be a nasal spray or there'll be something for you guys. IVF wasn't around for me when I had my
Right.
surgery. I mean, and I had my surgery in 2015. My daughter was 2009. Nobody ever offered me to save my embryos. Nope,
Right.
none of that.
Right.
The advances and knowing and just keeping her updated. She reads our blog every day that we feature somebody. She reads the blogs and just staying involved and like meeting you and meeting all the physicians that I work with, I think has helped her come to terms with what the facts of life are. And no
Yeah.
matter whether you have a genetic mutation or not, you're still at risk. So
Yeah.
just know your body, know your options, and continue to do your self-breast exams. And they don't take 5 minutes, they take 30.
Yep. Yeah. I always talk with Tracy about how the feeling on the first campaigns, like if we're not mindful as influencers, you can get a false sense that a self breast exam is like this very quick thing, that you can get through in the time that it takes to um, go through a reel, it's a very thorough and complex exam. It needs to be done standing and in front of a mirror and in the shower and laying flat on your back, and it involves your neck and your clavicles and your armpits, and you need to look in the mirror and look at skin changes, observe your nipples, squeeze them, see if blood comes out, all of these things. And for as much as we have this wonderful space called social media, and as much as we have this community, apart from, recognizing that there was just a complete void of community for Black women, a complete void of information resources that were specific to us, that there was no imagery for Black women and women of color. When I got diagnosed in 2018, there was so much misinformation that as a physician, I was like cringing. I was like, oh, hell no. Like, I'm not going to go through this and watch people misinform folks. And they may be well intended, but intentions can sometimes be harmful when they come with bad actions or when they come with misinformation. And so as a physician who is now wearing the shoes of a cancer patient, I was like, I'm a share because I don't see nobody that looks like me. And there's probably some other Black woman out there who's scared to death, who has this horrible image in her mind of what it's like to go through a cancer diagnosis or go through chemo. I'm gonna shed some light on it and say from a physician's perspective, like what you can do, how you can manage the side effects. And then I'm gonna just be a face where I don't see a face. I'm gonna just be representation where I don't see representation. And it's so important, but we still need to fact check all of these things.
And, like you brought up a really good point, like African American Black women, right? 40% higher mortality rate than white women. You know, Diversity is huge. We need to all come together and bring recognition to all communities. I
Yeah.
mean, I will never forget when I heard on a call 40% higher mortality rate. I'm like, what are we doing to make that difference? By raising money for research, it's not changing, ladies. Let's make a difference. Get our scans. There's funding out there. If you can't afford a mammogram, if you need an MRI, you need a doctor, reach out. There is so many resources out
Mm-hmm.
there. It's crazy. And I could tell you right now in the state of Florida, in Coconut Creek, where I live, June 5th, we have a mammogram event for 20 women in our city, underinsured, can't afford a screening. Letters of hardship will be requested. We have physicians that have partnered with us. to make this difference in this community. And in every community, we should try to do this because, yes, we could talk, sit here and educate you guys till you're blue in the face, but knowing your body and taking action and getting scans is so imperative.
Mm-hmm.
Whether your family history is there or not, if you feel something, take action. Don't waste time. Don't push it off. Yes, it's a scary process for anybody. I will never forget getting out of the shower like 2 days after I graduated high school at 18 years old and finding that lump and knowing that I needed to now go for a biopsy. Didn't even realize because I was Ashkenazi Jewish descent, I had a higher rate. Didn't
Mm-hmm.
realize that. Didn't realize the rate for PALB2 and BRCA and ETM and all these other gene mutations in different
Yeah.
ethnicities.
Yeah.
We need different ethnicities. We need you guys to step up, to come to clinical trials, to participate because every person has a different treatment.
Yep.
Without you guys, we're going to see less advancements in technology and medicine and actually have real data,
Yeah.
right? Like how hard is it? And maybe you can even touch base, like even in infectious disease, right? Out of white and when you take white to African American and Black women and put the percentages in trials, they're not equal.
Right.
We're seeing, right, more. No, we need African American women and Black women to come to these trials to help us make a difference, even if it's a aftermarket, post-marketing clinical trial to collect data. We
Yeah.
need data.
Yep.
Data is imperative. Joining these healing trials that are available, join them, ladies. They're here to help you. We're not guinea pigs. We're here to make a difference.
Yeah. It's so important. I mean, even like with my ATM variant, right? I've learned recently that Black folks are more likely to test positives for variants of undetermined clinical significance because, our genome is being, compared to this white standard genome, right? And so for certain genes, they have found out that there are specific variants that are relevant for cancer in Black people, right? Remember, we had the talk from the PhD from University
Sophia
of Miami.
George.
Yeah, right. And she was talking about the variant in
Mhm.
Trinidad and in the Caribbean. Um, that even though it's a variant, it's definitely clinically significant, and it's because of that particular heritage or lineage, right? And so we need to know this. They were able to study that in a very confined population over in Trinidad, but throughout the United States, because of the genetics of Black folks as well as folks coming in from different countries, unless we get more folks tested, unless we get involved in more clinical trials, we won't really be able to fully understand this information. And that may be the key to why we're dying 40% more. I mean, certainly some of it is systemic issues and there's some healthcare disparities, but your genes play a role in what cancer treatments you get, what chemos you get. BRCA2 and PALB2 cancers respond more to platinum based regimens, so carboplatin was thrown into my regimen. Otherwise, if we didn't know I was PALB2, I would have been in an ACT, adriamycin, cyclophosphamide, and Taxol, and my radiation, and that's it. So this information is critical to have, and no one should be shortchanged on their testing.
I just learned that our Mexican population actually is a really high percentage, like almost as high as African American. I'll send you the articles. Actually, we got them. One of the girls duly requested it, and I sent it to her. And we're going to actually start to work on, the Mexican population as well, because it's so important. Like, if we could recognize the different communities and bring more awareness to those communities.
Yes, and give people the care that they need and they deserve. If a doctor is like, I treat everybody the same, well, that's not acceptable because everybody is not the same. And my risk is different than Tracy's risk, is different than me have dogs, is different than Gigi's risk, is different than SBC's risk, is different than Chastity Renee's risk. It's different, right? We need care that is personalized. There's not a hard, fast rule, right? There's guidelines and there's standards of care, but you have to be able to apply that info accordingly to your patient. So we don't want to just accept, oh, I give the same care to everybody. I don't want my sister to have the same care as a white woman because it doesn't apply to her, you know?
Right.
So
I
give her the
agree.
care she needs as a black woman, but go as hard as you would for a white woman. Thank you very much.
Yeah. So, wrapping up tonight, I just want to thank everybody who tuned in. If any of your questions were not answered, we would definitely be here to answer them. You could send us a DM. I'm sure you could send Dr. Alexea a DM. She's always quick to respond and help people. But making sure that you guys know that these resources are always available and coming together just again as one is we're on similar paths, but different journeys and different treatment options. And no matter if I can help you as a survivor, we have survivors who are ovarian cancer survivors. Dr. Alexia herself is obviously a survivor, and we're here for you. And we just want to make sure that your journey and your process is easier in eliminating barriers, giving you resources at your fingertips. Again, listen out for clinical trials, check updated new information. We're always sharing articles and the newer information that is coming out, treatments, and just knowing that you're not alone. Because
Yeah.
I know through the process a lot, we think that we're alone and there's space that we isolate ourselves or, we come on and we're like, happy and just putting on these happy faces, knowing we're really hurting inside. And these are all normals. As Dr. Alexia says, allow yourself to feel the feels.
Feel all
And
the
if there's
feels.
right? And if there's anything that we can do here at Braca Strong, just make sure you reach out to us either through via email, DM us, like I said, DM Kate or Dr. Alexia. And, our mission really is to continue to help women and guide them and eliminate the financial and emotional burdens to help them with pre-mastectomy care packages. As of right now, I'm super excited. We launched on March 3rd. Thank you to my team and everybody that has helped us. We have funded 38 women pre-mastectomy care packages,
Woo-hoo!
which include a robe, drain belt, post-mastectomy bra, and 2 post-mastectomy pillows. And we continue to provide as we will launch some new sponsorships that are coming out, some new partnerships. Thank you, Kendra Scott. You actually outdid yourself on last Sunday's event. They raised $400 for us in their store. Till
Nice.
March 3rd, we have our fundraiser online. Mother's Day is around the corner. So, ladies, you want to share with your husbands the discount code, share with them. We appreciate everybody's support and time and donations as we continue to grow. And if there's anything we can ever help you with, just feel free to reach out to myself or any of our board members. And Dr. Alexia, thank you so much for coming on and just being
Oh,
real.
my
And,
pleasure.
like we always say when we talk, just sharing the truth is the most important part of a journey. Sometimes it hurts. Sometimes we can just move it. And, a lot of information that as we're closing out, I'd like to share is, I've heard a lot of women say recently a lot of information on a mastectomy isn't a boob job. And ladies,
Right.
get it right. A mastectomy is not a boob job. Let's bring awareness to this. Let's bring awareness to show who we truly are. Let's bring awareness, show support, get organizations, t-shirts, support them. We just launched 4 new t-shirts. Dr. Alexia has some amazing sweatshirts and t-shirts that are going to be online soon.
Yes.
Don't forget. But just support, make sure that who you're supporting is really making a difference and
Yes.
educating because
Yes.
coming on and showing our breasts on social media isn't helping us. It's not helping anybody. It's really hurting a lot more women and just coming on and sharing your story and the emotions that go behind it and the feelings and the inspiration and the empowerment to why we create organizations and to why we partner with such powerful, badass women.
Yes. Yes. Oh my God, I love it. I'm sitting like when I hear you say you funded 38 pre-mastectomy care packets. Yesterday, I shared a post that was in my stories memories from when I was 8 or 9 days post-op from my mastectomy. I still had my drains in place. Nobody told me about a robe or a bra with loops or, none of those things. Like I went home in that ugly, uncomfortable Velcro bra and I was told to like safety pin my drains to my shirt. And I was at the bus stop waiting on Kennedy, and the stupid drain like fell out, and it was just like dangling, the bloody drain dangling. And so, those pre-mastectomy care packages are so brilliant, so important, so valuable. And the reality is that when you're facing surgery and treatment and co-payments and time out of work, like, it's not in everybody's budget to buy one of those beautiful robes or to buy one of those amazing bras. So it's so important, that
Oh, did I lose you? Did we lose you? But on top of the pre-mastectomy care packages, we have bras for brave beauties where we fund the lymphedema sleeves and just bras in general or prosthetics. We've also partnered with Knitted Knockers. Feel free to go on their website, make a donation, or order your free knitted knocker. It's a life changer. I promise you, don't leave home without it. Goes in my vacation bags for now. An amazing product also that's just available out there. So, well, thank you so much again. We'll be on soon. Sending love to everybody.
Thank
Thank
you,
you.
everybody, for hanging in with us. This was amazing, Tracy.
Thank you. Thank you for all that you do to help us be amazing.
My
Truly.
absolute pleasure.
Perfect. Have a good one.
You as well.
All right.
Bye
Bye.
bye.